Hello everybody, welcome back to our series of NEET MDS 2021 recall. In this video, we are going to see about a very important topic, that is phases of clinical trials from the subject pharmacology that is used in drug approval. Okay, so this is a very interesting thing. So the question they have asked in NEET MDS 2021 was, which phase of clinical trial is used to include large population to check the effectiveness, dosage and safety of drugs? So which phase of clinical trial is used to include large population to check the effectiveness, dosage and safety of drugs? So the options they gave were phase 2, phase 1, phase 3 and phase 4. So let us just see what all the clinical phases that we have and what all they signify. Then I think maybe we can come to a conclusion and find an answer for this question. So the clinical trials. So clinical trials, what is a clinical trial? It is a way to test new methods of diagnosing, treating or preventing health conditions. Okay, so it is a way to test new methods of diagnosing, treating or preventing. So it is not only used for a drug approval, but it was also used to identify the new diagnosing methods, new preventive methods also. So the goal is to determine whether something is both safe and effective. Okay, a variety of things are evaluated through clinical trials, which include medications, medication combinations, new uses for existing medications and medical devices. So before doing a clinical trial, what we do is we perform a preclinical research. So it is performed on human cell cultures or animal models. So once after performing a preclinical research on, then only we'll use it on humans. Okay, so for example, they might test whether a new medication is toxic to a small sample of human cells in a laboratory. Okay, so the recent thing which we did was COVID-19 vaccine. Okay, so coming to the phases of clinical trials, this is a very important slide. Please make a note of it. So these are the phases which we use in clinical trials, but actually there are 6 phases of clinical trials. The first one is the preclinical studies. So we have seen that in the previous slide, right? So first we do preclinical studies, then followed by that we do these 5 stages. Okay, so these are the 5 phases of clinical trials. So phase 0 is microdosing studies. Phase 1 is human pharmacology and safety. Phase 2 is therapeutic exploratory or dose ranging. Phase 3 is therapeutic confirmatory or comparison. Phase 4 is post-marketing surveillance. So as we have seen what is preclinical studies, we'll be seeing all these 5 phases in the next slides, so that we can have a full knowledge on what every stage determines. So this is just a gist of what we are going to study further. So in this image you can see preclinical laboratory studies. So preclinical laboratory studies, it is duration is several years. It provides information on dosing and toxicity levels. Then coming to phase 1, it is safety or microdosing. Actually it is several months. It is to evaluate safety. So it is actually phase 1. Please make a note, they have not given phase 0 here, it is phase 1. So gather information about how a drug interacts with the human body. Then phase 2 is safety and dosing. It lasts for several months. So further evaluate the safety, monitor side effects, check with dose works best, check effectiveness. And phase 3, safety and efficacy. So duration is again several years. So it is to confirm effectiveness and monitor safety. Then after the drug is getting approved, then comes phase 4, that is post-marketing safety and efficacy. Okay, so we'll see what these phases are. This is just a gist. The next following slides will clearly explain what these phases are. So phase 0 or microdosing. So just keep in mind this image. Okay, phase 0 trial is nothing but it is a first human clinical trial of an unexamined drug. Okay, it is the first phase where a human clinical trial is done of an unexamined drug. Okay, what is it? So phase 0 of a clinical trial is done with a very small number of people, usually fewer than 15. So investigators use a very small dose of medication, that is the new drug, to make sure it isn't harmful to humans before they start using it in higher doses for later phases. If the medication acts differently than expected, then the investigators will likely do some additional preclinical research. So if they are seeing any differences in what they have seen in the preclinical studies during phase 0, what they'll do, they'll again go back for the preclinical research and then again come back from phase 0. Okay, so that is what will happen. The main objective of phase 0 is to obtain preliminary pharmacokinetic data. So pharmacokinetic data is the data which gives you the exact mechanism of action of the drug. Okay, exact mechanism of action of the drug, the dosage, everything. Phase 1, or human pharmacology and safety. So in this phase, what happens is investigators spend several months looking at the effects of the medication on about 20 to 80 people. They take a very small group of people, so that is less than 100, that is 20 to 80 people who have no underlying health conditions. So they are absolutely normal with no health conditions. So they spend several months while giving small dosage of medicine to these people and examining the effects. So the aim is to figure out the highest dose humans can take without any serious side effects. Okay, so that is the main aim of phase 1. So to figure out the highest dosage, so we have maximum dosages, right? We calculate it based on weight, based on age. So we calculate the maximum dosage of the drug which we can give, right? So that and all we'll calculate while we are in phase 1. Okay, so investigator monitor participants like very closely and see how their bodies react. So since they monitor very closely, that is why they'll take a few group of people. Okay, it is only 20 to 80. So the goal, so what is the goal? It is to conclude if the drug is safe for people, determine appropriate dosage, and understand how treatment is processed inside the body. Okay, so according to FDA, approximately 70% of the trusted source of medications move to next phase. Okay, then coming to phase 2. So phase 2 is also known as therapeutic exploratory or dose ranging. So phase 2 involves several hundred participants. So it involves several hundred participants who are living with the condition that we are going to treat. That means they are deceased people. So these several hundred participants are nothing but deceased people. Okay, so they have the condition that we are going to treat. So they are given a same dose that was found to be safe in the previous trial. Okay, so they are given a safe dose of medication. So this is done for several months or years to see how effective the medication is, and also to gather information about any other side effects it might cause. So in the previous thing, we have examined the side effects which it is causing on normal people, but now we are going to examine the side effects which it will cause on the deceased people, like disease for which we are going to treat. Okay, so it involves more participants, right? But it is still not large enough to estimate the overall safety of the medication. That means once a drug is passing phase 2, like it has passed the phase 2 trial, it is not safer to give to a larger population. Okay, so the FDA estimates that about 33% of the trusted sources of medications move on to phase 3. Okay, then coming to phase 3, or therapeutic confirmation or comparison. So phase 3 is usually involves up to 3,000 participants. So 3,000 participants is a quite huge number, right? Who have the condition that the new medication. So here also the same thing. We are taking the deceased people. Okay, trials in this phase can last for several years, of course, because we are taking so much huge population. We need to see the effects for several years down the lane. So the purpose of phase 3 is to evaluate how the new medication works in comparison to existing medications for the same condition. So this is to compare how the new drug is performing in comparison to the existing medications that have already been approved. So to move forward with the trial, investigators need to demonstrate that the medication is at least as safe and effective as existing treatment options, of course. So generally these are randomized double-blind trials. So the trials which we use here is in phase 3 is randomized double-blind trial. So we know what is a randomized double-blind trials, right? We pick up people in a random fashion, but we have a certain thing that they have to have the condition that we are going to treat, but we are going to pick up in a random fashion, that is male, female, age group. We are not going to see what it is. Then it is a double blind trial. Double blind trial is where the investigator does not know what it is. So what is the subject? He does not know the details of the subject properly, right? And even the participant does not know what he is going to take. So why we do this? To eliminate the bias that we'll get from the investigator side and also from the participant side. So we'll get a data after the trial which is very genuine, right? So that way we can interpret a genuine result of the drug. So if you are saying that, so for example, like we are giving a paracetamol, okay, so I'm giving a paracetamol to XYZ people, but I know this XYZ is not having fever. He is not, he's well, like he's not deceased, he's not having fever, he's well built, well nourished, everything. So what I'll interpret, that the paracetamol is safer for him and it is working good, right? So that itself I'll interpret. I'll not say that no, it is not good, it is not safe or anything like that, right? So and when the participant, so if this XYZ knows that he's getting paracetamol into his body, so he knows the drug causes decrease in fever. So what he'll say, even if he is not feeling this symptoms have gone, he'll say that my symptoms are gone, my symptoms are gone. So we'll not arrive to a conclusion which is genuine. So that is what is the double blind trial. Okay, so due to the large number of participations and longer duration of phase 3, rare and long term side effects are more likely to show up. Okay, so because of this, so rare and long term side effects will show up. So in phase 1, what happened? We have seen side effects which are occurring in normal population, right? In phase 2, we have seen side effects that are occurring in deceased people. This is immediate side effects. So immediate side effects occurring in deceased people due to the drug. In this phase, we are going to see rare and long-term side effects which are going to occur because of the drug. So roughly 25 to 30% of the trusted source of medications move to phase 4. Okay. So this is a very important phase for any drug. Okay. So because this is the only phase where the drug is being introduced into huge number of population. Huge population, right? First time that the drug is getting introduced into a huge population. There is 3,000 participants we are taking. So this is a very important phase for a drug to pass to avoid future complications. Then phase 4 or post-marketing surveillance. So in this phase, what happens? The drug, after the FDA has approved the medication. So once the drug passes phase 3, it will get approved for maximum. Okay, so it will get approved in phase 3. If it passes phase 3, then it will get approved. So okay, so remember this. So after that, what we'll do in phase 4 post-marketing surveillance. So once in phase 3, if it has passed, we'll release the drug into the market. So the market, it will get exposed to very huge number of population, right? So once it goes to very huge number of population, then we'll do surveillance there. to see what other side effects or what effectiveness the drug is showing. So this phase is phase 4. Okay. So this phase involves thousands of participants and can last for many years. Of course, we'll see it for many years. We'll not conclude it in a short span, right? So investigators use this phase to get more information about the medication's long-term safety, effectiveness, and any other benefits. Okay. So coming back to the question, so which phase of clinical trial is used to include large population to check the effectiveness, dosage, and safety of the drugs? Okay, so first of all, we include large population to check effectiveness, dosage, and safety. So here is the trick. In phase 4, what we'll do? It is already in the market. Okay, already in the market. So this is not the one. In phase 3, we introduce it to large population, right? That is around 3,000 people, and check their effectiveness, right, and side effects. So that we'll do for, of course, several years we do it. We don't do it for a short span and say that this drug is safe. So we do it for several years, and then depending upon it, we even decide upon the dosage also here only. So after deciding all these factors, then only this drug gets approved. So the most important phase in clinical trials is phase 3 for the drug to get approved. So the answer for this question will be phase 3, which is there in the option C. Okay. If at all this question is having clinical trial used to include large population to check the effectiveness, safety of drugs, which is already there in the market, then we can go for phase 4. But they have not given that it is already there in the market. Okay. So the first time the large population comes is phase 3. So the best option to go is option C. Okay. So if you like our video, do subscribe to our YouTube channel. You can also follow us on our Instagram handles at Docshala for dental content and at Docshala Medical for medical content. You can also follow us on Telegram. Thank you.